Um, I am here to talk to you about not patient involvement, but healthcare involvement, and it's how we patients can involve healthcare in taking care of our chronic disease. And I work at the Karolinska Institute in Stockholm, and I work with a very nice new project. We're looking at how to create a new personal medical record for every citizen in Sweden, available over our public resources. But I'm here to give you one example of how patients can involve healthcare. And so the question is, how can patients and family microsystems transform healthcare? We're now in the microsystem, not the one you're usually thinking about. We're now in the patient microsystem. This is cystic fibrosis is a disease with many perspectives and facets, but now we look at the lung disease of cystic fibrosis. And we're looking at the orders from the doctors, what you should do at home every day, 365 days per year. And this is work. It takes about 2 hours per day to work on this. And we have one patient that we're going to look at. And what's new here is that they say at the clinic that now we need to understand your asthma, because it seems that you have asthma also, not only cystic fibrosis. So at the center, they give us some easy tools to use, like a PEF meter, easily available. They give you some piece of paper and to take notes of measurements to start to understand asthma. At home, you have some other resources that you try. This is from Google Health, and you can start measure. So this is the tools they have at the clinic, and this is the tools we have at home. So we're still at home, and now that we have an overview, we can start to see new things. We can see patterns, how measurements, if it's 110 or 130 when you blow this, means something about the infection, means something about the asthma, is it allergies? We can start to see patterns, and we try to understand new things. Then we take these results and we go back to the CF center, and we now have outcome measures that mean something to the clinic. But what we can do at the CF center is, of course, to use these outcome measures that mean something. They mean something to both of us, but the only thing we as patients can do is improve the standard procedures. We can decide this is from the new drug that we got to monitor the asthma, and it says here that when you're blowing 120, 130, you should use this drug. So we see how we could improve clinical practice, but then we go home and we think some more. You use pen and paper and think and draw, and you feel that there must be something more here. There must be new forms of collaboration. There must be other things you can do. But this we cannot do with the clinical microsystems, because that's not their work. So what we do is we start a network, patients. So this particular small network is 12 patients, 6 from children's families and 6 from adult families. We do personal observations together, or each one, and we do small experiments. We have tools. We get an iPhone app from Silicon Valley. We start to look at things from our personal level, as a group, if we can learn new things, and organizational. Could we understand more about how our clinical microsystem works? And we work together and learn how to learn. That's the point here. And then we invite the CF Center. The head of the Stockholm CF Center is very happy that we invite them to work with us on changing care. And we can find physical therapists in other parts of Sweden that we can collaborate with. And we can invite for research too. So we tie this new data streams to the quality registries you've heard about to give new data that can help the CF care improve. So this was what I was going to tell you, and a way of looking at what we're doing is that we are transforming healthcare by managing this zone. This is the PEF measurements, and this is when we're home. These are outliers. We have to go to the clinic, we have to do some things, but we need to improve this, and that's our work. And we do it, and we manage it, and it will transform healthcare. So, some thank yous to Sara. Here is our project manager to get this going. We have one group in Stockholm, we have one group in San Francisco. Anna Esen is a researcher that is following us. Rajiv Mehta is a tech guy in Silicon Valley who's developing things. We found him over the internet too. And we're a group of CF pioneers. We are learning from Dartmouth Hitchcock about how we should, once we get work started with the healthcare system, how we could do that. We understand more things about measurements. Karolinska Institute, we work together and get resources, and we get a lot of inspiration from here. But the point here is that we have friends all over. They are entrepreneurs, normal people, managing consultants that look at things, reflect, and bring new ideas and new things here. So thank you very much.
Thank you very much, Andreas.
So I don't know if that was 12 minutes.
I don't know either.
It was, totally, yeah. Good.
Questions?
Sorry, you must have slipped my mind in the beginning, but who are we actually?
Exactly. And we don't know yet. But we are, it depends on how you look at this. But if you look at it as this group that is self-organizing, they are people living with cystic fibrosis and their families.
Oh, there's a whisper in the wind. Something's going on among the leaves. I can't put my finger on it, but it's calling out my name. There's no mistaking what this day has to say. It whispers in my ear.